While thousands of people have technically recovered from COVID-19, some of those who defeated the virus still say their lives are not back in order, including one Omaha woman. 3 News Now reporter John Madden spoke with her and explains why she doesn't want to be called a survivor just yet.
Do 2 more of those for me.
Therapy is now a way of life for Christine Thiele.
I was always proud that I was so healthy, and then bam.
Good. Inhale on the way down.
Back in April, Thiele says she tested positive for COVID-19.
I had the headaches, the GI issues, but I wasn't really that concerned. I just, I thought, okay, it's going to be a 2-week thing, I'll be fine.
But for this former nurse and fitness competitor with no pre-existing medical conditions, her health problems were far from over.
It's destroyed about every aspect of my life.
Thiele says doctors think the virus triggered an autoimmune disease, causing issues with her mobility.
1 more.
And after returning home, doctors found spots on her brain that impacted her day-to-day functions.
I had a lot of memory loss, very short term, like I would take my medicine and literally a minute later I couldn't remember.
So when she hears about the thousands who've recovered from the virus, she points out that can be misleading.
People are not comprehending that, oh yeah, you have a 99% chance of surviving, but there's thousands like me that are really having a hard time just dealing with permanent damage, chronic damage.
What we forget is that recovery doesn't mean you're entirely back to baseline. Recovery simply means you didn't die from the infection.
Dr. Kelly Cockcut of UNMC says some patients developed long-term effects with their heart, their brain, and overall well-being. She adds that medical experts just don't have enough data regarding a full recovery.
It will be very hard to predict until we have more data, what they look like, what the best treatments are, and if after even more time passes, people will get back to their prior baselines.
Good, good, good.
As for Thiele, she encourages everyone to still take this virus serious as she continues on the road to recovery.
I'm praying that I can get back to my normal self. So I'm praying I can go back to nursing, but there's no guarantees at this point of anything.
In Omaha, John Madden, 3 News Now.
Thiele says she's going to start cognitive therapy in the near future to help with brain function, but that therapy could last anywhere from 1 to 2 years.